Time now for Health Matters. I'm with Lynn Zabo, but we are not at Redwood Urgent Care. We are someplace else. Where are we, Lynn?
We're at Teen Clinic at College of the Redwoods, and Teen Clinic is run by Del Norte Community Health Center, part of Open Door Health Services, and I am the clinician for the Tuesday afternoon clinic from 1 to 5.
Wow, so what happens here? Why have a teen clinic?
Well, unfortunately, Del Norte County over the last couple of years has had almost double teen pregnancy rate compared to California in general in the United States. If you want the exact numbers, California in general is 29 unintended teen pregnancies per 1,000 teens, and they're looking at ages 15 through 19. Humboldt is about 34.3. No, sorry, that's the United States. Is at 34.3 per 1,000 teens. Del Norte is a whopping 64.4
Whoa.
per 1,000 teens.
Wow.
Yeah. And many of the Del Norte teens are actually 19-year-olds who are on their second pregnancy. So we got the need here, and Open Doors stepped up and made the teen clinic some years ago. Teen clinics in general are kind of a focus of all of their clinic sites, but this one in particular, they're quite dedicated to it.
So what sorts of health issues besides unintended teen pregnancy are dealt with here? Is it just anything?
Yeah, besides contraception, they also do STDs, and I think that they do immunization for HPV for kids that need that, both young men and young women. So they can also do exams here. We're sitting in an exam room, actually, which also has a desk in it. But I have been able to put in Nexplanons, which is a kind of birth control that goes in the arm. And I know I have capacity to put in IUDs here if somebody came in and wanted one.
What's the volume? Are there a lot of teens looking for healthcare, health advice?
Some days it's kind of busy, actually. And it kind of depends a little bit on what's going on across the way, which is the high school. Since the summer started, most people seem like they've either got summer jobs or gone out of town, and they're not really focused on coming here. Also, we kind of had a change in dates. It used to be the clinician was here on Wednesday afternoons, and now, since I've started a couple weeks ago, it's Tuesday. So I think there's a little confusion in sorting that out, and that's part of the reason I wanted to talk about this today. I'm here on Tuesday from 1 to 5, but the clinic is open both Tuesday and Wednesday. So if somebody wanted to drop in and get tested and maybe get condoms, they could totally do that on Wednesday. They don't need a clinician to do that.
Okay, yeah. What sort of things? How does it change if a clinician, if you're not here on Wednesday? Then is there what doesn't happen?
Well, I do things like prescriptions and exams, but they have a latitude to do testing and to give contraceptives that are non-prescription, say condoms.
Yeah.
And I think they do hand out morning after pills too. They have standing orders for that.
Wow.
And so that happens now mostly on Wednesday, but I'm here on Tuesday to do the medical lifting, I guess.
The medical lifting.
Yeah.
And you mentioned some of the things that you do as the clinician. What other options are here? What other things are on your shoulders when you're at the teen clinic?
When I'm at the teen clinic, well, I start people on birth control pills. I change people who are having problems to different pills. I talk about contraceptive NuvaRing, which is intravaginal contraceptive, hormonal. I talk about patches, which are self-adhesed estrogen-containing birth control methods that are quite effective. I talk about, for people that are interested in Depo-Provera, which is an injectable contraceptive. I talk about IUDs if people are interested in that, which is a little more invasive, so intrauterine device. But they have some that have hormones in them and some that don't. And they're very, very effective and also very long-term. Don't usually cause people too much in the way of problems. They're not like the old IUDs of the 60s that our mothers remember. So,
I don't even want to visualize what
no,
this.
they're much, much better. And then, we could also, let's see, talk to young men about condom use. There's female condoms, there's dental dams, there's a lot available.
What is it? How does it stand with minors and information about and access to contraception?
So in California, minors over the age of, I believe, 13 and up to and above 18, of course, have the legal right to get confidential reproductive health care at places like this. And there is grant money available through the state that covers it. So the minor wouldn't have to worry about, something like a parent getting a bill or something like that and finding out if that's not what they wanted to have happen. Of course, we always kind of encourage teens to talk to their parents because, their parents do hope for the best for them in most relationships. And the more information they can get from them, the better. So, but they do have the right to privacy, and I think that's really important. They also have the right to get out of class.
How do you mean, really?
Well, let's say I have a 2 o'clock or 1 o'clock Spanish class, but I'm concerned on getting a refill of my pills, and I decided to come to teen clinic on Tuesday at 1 o'clock instead of go to my Spanish class. That's an excuse, and it's an excused absence, and it is something that's confidential from parents.
I did not know that. Wow. Is there any evidence out there, studies-wise, that access to places like the teen clinic have an effectiveness against
absolutely.
teen pregnancy?
Yeah, absolutely. And the more kids know about the mechanics of sex, kind of the more information they have about the emotional aspects of sex, the more information they have about their ability to get contraceptive care or to get treatment for STDs, actually the less likely they are to engage in intercourse early. So they can come at this important life decision with a more informed, medically accurate viewpoint, and they do a lot better.
Wow. How long has the clinic been here?
Well, I've known about it, I would say probably for about 7 years,
Okay.
maybe 10 years. I don't really know exactly, but it's been around a long time and been established. Hasn't really been at the site the whole time. It was off campus in a different direction for a while, but there was some community resistance to that, and so College of the Redwoods was gracious enough to give us facilities, and they're beautiful here. I'd say it's really, it's private. You don't have to worry about going in the clinic and seeing your mom's friend in the waiting room. It's teen oriented, it's clean, it's got a lot of light, and it's got just about anything a teen might need to get their questions answered.
Wi-Fi?
Yep. Totally. I imagine so.
Yeah.
On CR campus, I imagine so.
What do you you mentioned that, and I remember this in the past when there was some community pushback with the teen clinic when it was located in the other place. How do you address that? What do you say to parents concerned about who can maybe come to it with, oh, well, you don't want to talk about these things with the teen because they shouldn't be talking about these things and this shouldn't be a part of their life?
I guess it depends on what endpoint you want to be. It is data driven that the more information that you give teens, the better able they are to make good decisions. The data show actually that teens that are educated about contraception actually defer sex until first intercourse until later age. So I think we ought to give the kids some credit.
Yeah.
All they really need is information, and that doesn't mean that they're necessarily going to act on it. But we want to keep them healthy, and we want to keep them on a path of their life that kind of makes sense to them, and not just kind of randomly. Most teen pregnancies are unintended, and when I talk to teens in my other practice, especially when I was working in a walk-in clinic here, they didn't seem particularly like they were thinking about it too much, and they were all pretty, at least the women were pretty resigned to fate, which is kind of sad. I really want more for the young women in this community. I'd rather hear things like, well, I'm hoping to get my gen ed done at College of the Redwoods and then move on, and I just don't see a pregnancy in my future right now, maybe later. But when I want it, not when it just kind of falls out of the sky.
Yeah, exactly. It's interesting that you point out that first off, yeah, you say give credit to teens, and definitely, because there are so many segments of our society when presented with information nowadays just kind of ignore it and go about their stuff. But if teens are actually listening and seeing the benefits of knowledge and information, and then also the flip side of that is that the less information teens have, so if you close this down, the more teen pregnancies
it's pretty clear that abstinence only sex ed doesn't really work.
Wow.
That teens really want, and that they're mature enough to handle information. I don't think that they're just seeing it as some permission to go out and get crazy. I think that it's kind of like getting one's driver's license and having to learn the rules of the road first. I think that they take, for the most part, they take that information and they make really good decisions.
That's good. That gives me hope. That's nice.
Oh yeah.
So you've got employment opportunities. You've got things happening.
I know. This is one of the reasons we timed this for this part of our cycle. So, on July 12th, we're going to be having a free kind of training for talking about the teen clinic, STDs, and contraception in general. It's from 10 to 3 at Del Norte Community High School. There's going to be food.
At where?
I'm sorry, Del Norte Community Health Center.
Okay, good.
Sorry, not the high school. Del Norte Community Health Center. Yeah, it's going to be free. There'll be food there. It'll be kind of a teen-friendly environment. But the cool thing is that we're looking at people who might be interested in actually getting employed and continuing kind of their education along this line, and be kind of teen helpers in the teen clinic here. And that would be a really cool, I think, high school part-time job. It pays minimum wage. It's probably 2 days a week. Scheduling, I don't really have any control over that, so it's hard to say how many hours a week, but available coverage for the week would be 8 hours, and they're looking for multiple people. And I think it could be a good resume builder. I think it could be something that would look good on a college application. And I think, it could help earn it a little bit of extra money and then maybe jump to a different kind of job later.
And it would be a good thing if, teens coming into the clinic dealing with other teens, or would that be off-putting, do you think?
I think teens like talking to teens.
I think so, yeah.
Yeah, I think they understand the importance of confidentiality. I've never, in the teen clinics I've worked with at Planned Parenthood, never had any problems with people breaking confidentiality. It's a really important part of this business and medical care in general. So,
wow,
yeah,
awesome.
It's something they're going to learn.
Exactly. And so that's a Friday, the 12th, right?
Yeah, the 12th, 10 a.m. to 3 p.m.
Any sort of pre-registration? Is it just showing up?
Just show up at Del Norte Community Health Center. Okay. So we all know where that is on East Washington, kind of near the intersection between East Washington and North Crest.
Okay. So. All right, that sounds good. Anything else that you'd like to add about the teen clinic? Anything I wasn't hip to and didn't ask you about?
I just want better for the teens of Del Norte County. I think that there are a lot of really vibrant, talented people who could go in a lot of different directions and really provide for our community, especially there's a lot of kids who I think who are interested in medicine eventually. There's kind of a push right now to demonstrate to teens that medicine is a really viable opportunity in this community. God knows we need them, and if we can't import them from out of the area, maybe we can raise our own. This would be an excellent start for a medically minded teen who's interested in giving back to the community.
And any sort of subsequent career plans that teens develop, it's not just about doctors and nurses. There are a lot of different career pathways.
There's a lot of health administrators, grant writers, medical assistants, RNs. RNs, our LVNs and registered nurses, they can go in a lot of different directions. Even in government work, nurse practitioners, physicians assistants, and of course physicians, but really, the sky's the limit, and I think we have a lot of talent here, and I would really like to see it encouraged.
Fantastic. Lynn, thank you very much. Once again, before we get out of here, let's give everybody the location and times the teen clinic is accessible.
Teen clinic is accessible at College of the Redwoods. It's pretty obvious which building it is. It has a big sign on the front. It's within sight of the high school. And that is, it's open here and staffed on Tuesday from 1 to 5. That's when the clinician is here, and that would be me. And Wednesday, 1 to 5. There's other staff on site that can still help with people picking up non-prescription birth control or needing to get tested, or maybe a pregnancy test, that kind of stuff.
Is there any sort of appointment regimen, or is it just drop in?
It's just walk in, and there's grant money available, and it's confidential. So,
wonderful.
Yeah.
Well, thank you, Lynn.
Yeah, thanks.
All right. We'll see you next week at the usual spot, right?
Yep.
Okay.
Yeah.